Question 1. A nurse is caring for a patient in the manic phase of bipolar disorder. Which action should be the nurse's priority? A. Administer lorazepam to a patient pacing in the hallway and shouting at staff. B. Assess a bipolar patient sleeping soundly in the room. C. Redirect a manic patient demanding to call family repeatedly. D. Provide snacks to a stable patient requesting extra food. Answer. A. Administer lorazepam to a patient pacing in the hallway and shouting at staff. Question 2. A manic patient is attempting to give away their belongings. What is the nurse's most appropriate action? A. Allow the behavior if it promotes therapeutic rapport. B. Contact security to remove the patient from the unit. C. Redirect the patient and explain unit policies on personal property. D. Accept the gifts to avoid confrontation. Answer. C. Redirect the patient and explain unit policies on personal property. Question 3. Which task can the nurse delegate to a UAP caring for a patient in the depressive phase of bipolar disorder? A. Evaluate the patient's risk for suicide. B. Monitor for medication side effects. C. Assist the patient with morning hygiene and grooming. D. Teach the patient about lithium therapy. Answer. C. Assist the patient with morning hygiene and grooming. Question 4. A patient in a manic state is rapidly talking, pacing, and refusing to eat. What is the nurse's priority intervention? A. Ask the patient to sit and finish their meal. B. Offer high-calorie finger foods and fluids. C. Encourage the patient to rest quietly in bed. D. Call the provider to request physical restraints. Answer. B. Offer high-calorie finger foods and fluids. Question 5. A client in a manic episode insists on leading a group activity. What should the nurse do? A. Allow the client to lead to promote self-esteem. B. Set clear boundaries and redirect the client to a quieter task. C. Encourage other clients to follow along. D. Leave the group session to avoid escalating the situation. Answer. B. Set clear boundaries and redirect the client to a quieter task. Question 6. A nurse is assessing a patient with bipolar disorder who has been on lithium. Which finding requires immediate intervention? A. Mild hand tremor. B. Increased thirst. C. Diarrhea and muscle weakness. D. Weight gain of 2 pounds in a week. Answer. C. Diarrhea and muscle weakness. Question 7. A nurse receives shift report on 4 patients with bipolar disorder. Who should be assessed first? A. A patient sleeping in their room. B. A patient requesting snacks. C. A patient who has not spoken to anyone all day. D. A patient who has threatened to punch a staff member. Answer. D. A patient who has threatened to punch a staff member. Question 8. Which statement by a patient taking lithium indicates the need for further teaching? A. I will drink 2 to 3 liters of water a day. B. I can take ibuprofen for headaches. C. I will have my blood levels checked regularly. D. I will avoid drinking alcohol. Answer. B. I can take ibuprofen for headaches. Question 9. During a manic episode, which activity is most therapeutic for the patient? A. Group therapy session. B. Competitive board games. C. One-on-one structured task with staff. D. Watching television in a crowded lounge. Answer. C. One-on-one structured task with staff. Question 10. A nurse is educating a patient with bipolar disorder about Valproate. Which lab should the nurse emphasize for routine monitoring? A. BUN and creatinine. B. Liver function tests. C. Electrolytes. D. Hemoglobin A1C. Answer. B. Liver function tests. Question 11. Which statement by the UAP caring for a bipolar patient in a manic phase would require nurse intervention? A. I will help the patient take a bath. B. I will sit with the patient during meals. C. I told the patient they could lead the unit meeting today. D. I encouraged the patient to take a nap. Answer. C. I told the patient they could lead the unit meeting today. Question 12. A patient with bipolar disorder is becoming increasingly loud and disruptive. What is the nurse's first response? A. Administer a sedative as ordered. B. Escort the patient to their room for a quiet activity. C. Call hospital security. D. Ignore the behavior to avoid reinforcing it. Answer. B. Escort the patient to their room for a quiet activity. Question 13. The charge nurse is assigning rooms. Which patient is most appropriate to room with a patient in a manic episode? A. A patient with schizophrenia and auditory hallucinations. B. A patient with major depression and suicidal ideation. C. A stable patient recovering from pneumonia. D. Another patient currently in a manic state. Answer. C. A stable patient recovering from pneumonia. Question 14. A patient in a manic episode is pacing rapidly, speaking loudly, and refusing medication. What is the priority nursing action? A. Attempt to calm the patient using therapeutic communication. B. Call the provider for an immediate sedation order. C. Instruct the patient to stop pacing. D. Leave the patient alone to de-escalate. Answer. A. Attempt to calm the patient using therapeutic communication. Question 15. Which menu choice is most appropriate for a patient with mania? A. Roast chicken with mashed potatoes. B. Cheeseburger and apple slices. C. Spaghetti and meatballs with salad. D. Baked fish with steamed vegetables. Answer. B. Cheeseburger and apple slices. Question 16. The nurse is educating a family about bipolar disorder. Which statement indicates accurate understanding? A. Manic episodes can be triggered by lack of sleep. B. We should allow him to act out his energy freely. C. He should stop medication once he feels better. D. Hospitalization is always required during depression. Answer. A. Manic episodes can be triggered by lack of sleep. Question 17. Which behavior in a bipolar patient on lithium indicates a need for immediate intervention? A. Complains of frequent urination. B. Refuses dinner but drinks water. C. Exhibits hand tremors and blurred vision. D. Sleeps 10 hours at night. Answer. C. Exhibits hand tremors and blurred vision. Question 18. Which task should the nurse not delegate to a UAP for a patient with bipolar disorder? A. Provide fluids and snacks. B. Assist with hygiene care. C. Monitor for escalating behavior. D. Walk with the patient in the hallway. Answer. C. Monitor for escalating behavior. Question 19. A nurse is planning care for a manic patient. Which activity is most appropriate to include? A. Open discussion groups. B. Reading group in the library. C. Structured solitary activity like painting. D. Watching movies with peers. Answer. C. Structured solitary activity like painting. Question 20. A patient with bipolar disorder tells the nurse, "I don't need this medication anymore." What is the nurse's best response? A. You'll be hospitalized if you stop taking it. B. Let's talk about why you feel that way. C. I'll call your provider immediately. D. You can stop once the provider approves. Answer. B. Let's talk about why you feel that way. Question 21. A manic patient is constantly interrupting others in group therapy. What is the nurse's best action? A. Ignore the behavior and allow group to continue. B. Remove the patient from the group and explain the need for respectful behavior. C. Allow the patient to lead the group to redirect energy. D. Ask the group to adapt to the patient's behavior. Answer: B. Remove the patient from the group and explain the need for respectful behavior. Question 22. A nurse finds a manic patient in another patient's room. What is the priority nursing action? A. Educate the patient about respecting boundaries. B. Remove the patient immediately and ensure the safety of both patients. C. Ask the roommate to allow the interaction briefly. D. Tell the patient to stay seated in the room. Answer: B. Remove the patient immediately and ensure the safety of both patients. Question 23. Which lab result is most concerning for a patient on Valproate therapy? A. AST35U/L. B. ALT112U/L. C. Platelet count 250, 000/mm superscript 3. D. Sodium 140 milliequivalent/L. Answer: B. ALT112U/L. Question 24. A newly admitted manic patient is loudly singing and dressing inappropriately. What is the initial nursing intervention? A. Offer quiet redirection and assist with appropriate clothing. B. Ask the patient to change immediately. C. Allow self-expression without restriction. D. Notify the physician of the behavior. Answer: A. Offer quiet redirection and assist with appropriate clothing. Question 25. A manic patient suddenly accuses the nurse of poisoning their food. What is the nurse's best response? A. You are mistaken, please eat your meal. B. Why do you think I'm poisoning you? C. You seem upset, let's talk about how you're feeling. D. I'll have someone else bring your meal. Answer: C. You seem upset, let's talk about how you're feeling. Question 26. Which intervention is most appropriate for a patient in the manic phase with decreased sleep? A. Provide frequent distractions to keep the patient busy. B. Encourage rest periods and limit stimulating activities. C. Allow the patient to skip sleep if they don't feel tired. D. Offer caffeine-free energy drinks. Answer: B. Encourage rest periods and limit stimulating activities. Question 27. A nurse is teaching a patient starting lithium. Which instruction is most important? A. Stop the medication if you feel shaky. B. Take this medication with food. C. Avoid high-sodium foods. D. Drink plenty of fluids daily. Answer: D. Drink plenty of fluids daily. Question 28. Which symptom suggests early lithium toxicity? A. Nausea and vomiting. B. Bradycardia and hypotension. C. Hyperactivity and confusion. D. Muscle cramps and seizures. Answer: A. Nausea and vomiting. Question 29. A patient tells the nurse, I feel so powerful I can fly. What is the priority concern? A. Sleep deprivation. B. Risk for impaired judgment. C. Medication non-adherence. D. Risk for injury. Answer: D. Risk for injury. Question 30. A manic patient is demanding and controlling with staff. What is the nurse's best response? A. Respond passively to avoid confrontation. B. Set firm, clear limits on behavior. C. Provide whatever is requested to calm the patient. D. Avoid interactions unless necessary. Answer: B. Set firm, clear limits on behavior. Question 31. Which activity is most appropriate to promote safety and engagement for a manic patient? A. Playing competitive sports. B. Coloring or sketching in a quiet area. C. Leading a music group. D. Debating with peers. Answer: B. Coloring or sketching in a quiet area. Question 32. A nurse caring for a manic patient notes pressured speech and flight of ideas. What is the most therapeutic response? A. Please calm down and talk slowly. B. You are not making any sense. C. Let's take a break and talk one step at a time. D. I can't understand what you're saying. Answer: C. Let's take a break and talk one step at a time. Question 33. A manic patient refuses oral medication. What is the nurse's next action? A. Hide the medication in food. B. Discuss the reasons for refusal and possible consequences. C. Notify the psychiatrist for discharge. D. Discontinue the medication. Answer: B. Discuss the reasons for refusal and possible consequences. Question 34. What is the nurse's priority when a bipolar patient reports not sleeping for 48 hours? A. Administer a PRN stimulant. B. Encourage the patient to join group activities. C. Reduce stimulation and promote rest. D. Offer extra snacks to restore energy. Answer: C. Reduce stimulation and promote rest. Question 35. A family member asks if the patient can stop lithium now that mood is stable. What is the nurse's best reply? A. That decision should be based on your financial needs. B. Only the provider can decide that, but stopping may cause relapse. C. Yes, most people stop lithium after a few weeks. D. If you feel fine, you can taper it yourself. Answer: B. Only the provider can decide that, but stopping may cause relapse. Question 36. A manic patient says, "I can do anything. I'm invincible." Which nursing diagnosis is most appropriate? A. Chronic low self-esteem. B. Risk for self-directed violence. C. Disturbed sensory perception. D. Risk for injury. Answer: D. Risk for injury. Question 37. Which client statement indicates effective coping with bipolar disorder? A. I only take medication when I'm feeling low. B. I've learned to recognize when I need help. C. I stay up for days when I'm feeling good. D. I don't talk to anyone when I feel down. Answer: B. I've learned to recognize when I need help. Question 38. A nurse is caring for a patient who is hyperverbal and intrusive. What is the most appropriate response? A. You're talking too much. Please stop now. B. Let's find a quieter place where we can talk. C. You can keep talking if others don't mind. D. Please calm down before continuing. Answer: B. Let's find a quieter place where we can talk. Question 39. Which behavior indicates a therapeutic effect of mood stabilizers in bipolar disorder? A. Sleeping 2 hours per night. B. Refusing food and isolating. C. Engaging in conversations and completing daily activities. D. Talking rapidly and pacing halls. Answer: C. Engaging in conversations and completing daily activities. Question 40. What should the nurse include in discharge teaching for a patient prescribed lithium? A. Reduce fluid intake to prevent bloating. B. Eat more salty foods to balance the medication. C. Avoid NSAIDs like ibuprofen. D. Double the dose if you miss one. Answer: C. Avoid NSAIDs like ibuprofen. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.